Hi, I'm Ashley Connolly, and I am a licensed professional counselor. I'm based out of Aspen, Colorado. I'm actually a sober coach as well. I've started an intensive therapeutic sober coaching program, started that a few years ago, and I'm in long-term recovery myself. So I've got that unique mix, I think, of being in recovery and being a mental health professional. And so just very passionate about helping people and really passionate about the idea that there's just not a one size fits all approach to treating recovery and addiction.
Tell us a little bit more about your coaching program.
So I started the coaching program because I realized that the traditional therapeutic model of 50-minute sessions once a week, which is, how most of us, we're trained as that's kind of the standard, sometimes twice a week if somebody needs more, and really no contact in between really wasn't enough for a lot of the people I was treating in addiction. I work with a lot of people either straight out of a treatment center or people that are sort of in recovery but having other mental health issues. Or increasingly, I've been working a lot with the sort of sober curious people, like people that maybe don't have a huge problem but are like, what would life be like without drugs and alcohol? Maybe there's a little problem, but nothing big. But what I realized is that, when you're making a life change, like stopping a substance, especially if it is a problem, you need more than weekly therapy. So I created this program, and it's a lot based on, I used to work for a nonprofit in Aspen called The Right Door, and it had a pretty neat model. The nonprofit folded, but it gave me some great ideas of the clients had to do a daily check-in call. They had weekly homework. They had, weekly therapy. And then what I added into that is a call. So basically, the client will sign up for this intensive coaching program, and they'll get sort of a weekly session, which will do more of the therapeutic, deeper work. But then they'll be required to check in with me daily via text or email, or just leave me a voicemail. We'll have one phone session. I have this sober coaching workbook that I put together that's just sort of all my worksheets, but it's a 12-week program, and so they have to do their homework. They sign a contract when they start with me, so where they agree that if I haven't heard from them for 3 times, like 3 times of me sort of saying, hey, texting back or calling or emailing, then they have already signed that I agree to contact whatever person, whether it's a spouse or a parent or, employer. Sometimes the people in this program are, their loved one, their parent, their spouse is saying, hey, you need some support. And so they're nudged into it. But it's been quite rewarding, I think, for me and for my clients. Really, I believe that people just need to be loved into recovery, not shamed into recovery. And so that's sort of the premise behind the sober coaching program.
I love the sober curious. I hadn't heard that term before.
Yeah.
I know those people, but I'd
Uh-huh.
never heard that term before. That's really great. And I know now, do you work are you a single practitioner in this, or do you train other coaches? Do you have aspirations to do that?
So right now I have one person that works with me
Okay.
as a sober coach, and he's been somebody that's worked for Hazelton and Betty Ford, and he's been in long-term recovery himself, and a prevention expert. So yeah, because I've created the model, and so the people follow it. But it really, what it is about the coaching program, I think that's so unique, is that we only take a handful of people, so it's manageable. That we say, look, we're here for you 24. I mean, obviously, I might not be able to respond right away, but within 24 hours, we can respond to crisis, because that's when life, crisis doesn't always happen in that 50 minutes that you're scheduled, and so far people don't abuse it. For the vast majority of people are quite respectful. But yes, so I've trained one other gentleman, because it's nice. There are sometimes what happens is the wife comes in and sees me, and so I sort of become her therapist, but it's really the husband that needs help. And then it's like, usually I don't want to see them both. And so it's been nice to be able to like pass off. And sometimes people like, a gender person. So I have, but I'm also thinking about training another gal. So yeah, and I've written a book called Life 101 years ago, which is just sort of basic fundamental principles. But I'm going to do one called Sober 101, just to have sort of basic principles of getting sober and staying sober.
And what do you see some of those basic principles are that'll be the tenets of that book?
Um, I think, some of these are borrowed from the 12-step community. Some of the ideas of, lead with your actions, not your feelings, is that, so often people think, if I could just figure out why I drink, then, why I drink, why I use, why I do this compulsive behavior, then I'll get better. But what I teach people is that we can change the behavior and then work on things. You don't have to wait because we don't know when insight will come. Sometimes it's not right away. So I teach a lot about leading with your actions. I think the two fundamental things that I've seen that work for people to stay sober, whether it's from drug or alcohol or other compulsive behaviors, is community and spirituality. So I work with them to find a way, and I don't think AA is the only way. But that is one way that's worked for a lot of people. But for a lot of other people, I help them find community through, I think we're lucky. Oh, I don't have my iPhone, but with these little computers in our pocket, there are ways to genuinely connect with other people online. And so you can find a community of people that are going through what you're going through. And I help clients find a community if they're really not comfortable going to AA. And then I help them develop their spirituality, whether it's through a mindfulness practice or, refuge recovery, which is a more Buddhist framework, or Christian. I mean, I'm really open. It's not, I think people can get boxed into what spirituality is. But what I do find is that for people that are successful at getting and staying sober, they need to find some connection to something greater than themselves. So I have a background in transpersonal psychology, which is, just essentially spiritual psychology. So I really am able to help integrate that piece with more of sort of traditional cognitive behavioral therapy strategies.
Sounds like you're really meeting them where they are.
Yeah, I do. I really do. I think what makes me so sad is that oftentimes, there's different treatment programs I've worked with that it says, you've got to do this, you've got to do it this way. And so, or, if somebody relapses, well, you're out of the program. And then those are the people that need treatment the most. So what I tell, and I remember I was even trained in graduate school that if a client is still drinking or using, it's unethical to continue treating them. And I get that to some respect, but we also know addiction is a disease. And we know that relapse is part of it. And so I believe, and I tell them up front because I don't ever want to be confronted with, well, you're still, because I had one client that it took her a year of working with me. And then she just called and said, I have a year sober. So it takes a while sometimes, not always. But what I tell clients is I say, I will never fire you. You can fire me. But I will never abandon you as your therapist, even if you keep using. Part of the contract is that if they relapse, they commit to a higher level of care, right. Which is okay, they'll agree to go to inpatient or they'll do something higher. But just as, I used to do some grief work with this cancer and worked closely with an oncologist. And, the oncologist would never fire their patient because the cancer came back. Oh, well, there's nothing I can do anymore. And we do that in addiction, and so I'm really trying to change that paradigm with, just meeting people and staying with them, even if they're stuck in their disease, because sometimes I'm the only person they can talk to because they've been abandoned by friends and family.
There's a line in the movie, the Joker, that came out this year, and it was actually an excerpt from his journal, and he suffered from mental illness, and it said the worst part of having a mental illness is people expect you to act like you don't. Yeah. And I think that's exactly what you're talking to. Oftentimes people are asked to leave treatment for exhibiting the symptoms of why they were there in the first place. Now, of course, if they're harming themselves or somebody else, that's a different story. But we can't. If they could just do it on the first time on their own, they wouldn't necessarily need us. Right. And that's just not shown. Hasn't shown that's what folks need. So it's really great to meet you and understand what you're doing. And we really look forward to working with partners like you. We're looking to build a robust coaching program that's not just internal. That we're working with coaches out in the world because we see that as the way to support people in long-term recovery. Yeah. Because it's not. Treatment can't be an event. It needs to be something that's happening over time and stepping down and having support for an extended period of time. That's how, people do better. Yeah.
And I'd like to just add that my work can be done. I have some local clients in Aspen, but I actually started the coaching program because I got inquiries out of California. I have a lot of therapist friends in California. And so using online platforms, I could see clients from wherever. I always like, if I can, to get a face-to-face initially, but if not, with the technology today, we can really work together from a distance.
So one last question. What do you love most about your work?
Oh my goodness. I love, love, love just the opportunity to connect and to deeply know people. You know, I really believe that all of our problems would be solved if you could just sit down and hear somebody's story, you know, even in just 50 minutes of talking to somebody. So I love the human connection. I love seeing people change and grow. And I'm just passionate. I'm also really passionate about beginning to have this conversation that drugs and alcohol don't need to be such a prominent part of our society, not just for those people who are addicts, but for others, that more and more people can begin to choose sobriety as a way of life, the same way people choose to be a vegan or to do yoga or all these different things, is that, you know, sobriety can be a vibrant option, not just because you're sick and you can't handle it, but because you want to live your healthiest, your best life.
Thank you for spending this time with us here this afternoon, and thank you for coming to visit, and thank you for the work you do in the world.
Thank you. Thank you guys, too.